Hi, my name is Claire Dutch. I'm a partner at Hogan, Lovells International. It gives me great pleasure to introduce this morning Professor Sir Malcolm Grant, who is going to talk on the vitally important subject of how the NHS and the planning system can better work together to address the healthcare crisis that we face. Malcolm is uniquely qualified to talk about this. He's a barrister, an academic, a planning and environmental lawyer, and importantly, he was the chair of the NHS until last year. Malcolm, good morning.
Good morning, Claire.
So, we've read your paper with interest. Why do you argue that health needs to become absolutely central to planning?
At its origin, of course, health was absolutely central to planning. In 1948, we had these two dramatic new systems. A system of town and country planning that's still probably the most dirigiste in the Western world, and a system of health that is the most communitarian in the Western world because it spreads the risk of ill health and its cost across the entire population. But you can't allow these two to continue to diverge in the way which I believe they have since 1948. We have the power to bring them much more closely together, to integrate them, and to concentrate on the changes that have occurred in both sectors, for health particularly, a move away from communicable disease, infection and accident and acute illness as being the major cause of ill health, which it was in 1948, to what it is in 2019, which is non-communicable disease. The burden of disease has shifted dramatically, and the environment in which people live is a major component of that.
So how is the NHS model changing to try and address all that?
We're trying to change from the inherited model, which was GPs and hospitals, operating through different incentive systems, different funding systems, and often with quite difficult interactions between the two, into a model in which budgets are amalgamated, emerged. Big experiment going on in Greater Manchester at the moment, where we try to do this with social care as well, to try to ensure that the Manchester pound is spent in the best interests of the patient rather than in sustaining the different institutions that provide healthcare. So we're going to take on probably the biggest and most radical change in the provision of healthcare anywhere in the world over the next few years, with a much more integrated model and with the pound following the patient rather than the doctor.
So how is planning relevant to this in terms of, I read in your paper about a new towns programme and 10 demonstrator sites. Can you just explain how that's intended to work?
For the first time ever, the NHS has reached across into the planning system and said, how can we help? It doesn't sound entirely convincing, but we've invested millions of pounds into trying to understand how we can better integrate health into the design of new settlements. Old settlements is much more difficult. With new settlements, I think we are losing our capacity to impact, particularly on the lives and health of children, unless we better integrate these two. So we set up 10 demonstrator sites, we're working with them, we're trying to understand how we can persuade developers and local authorities in partnership to assume responsibility not just for providing houses, but for providing areas of housing which will have sustainable activity levels, sustainable community engagement, sustainable relationships which are intergenerational between children, parents, grandparents and older generations. There's nothing hugely radical about this, but I fear that we need to re-inject these principles into the planning system against this change in the burden of disease across the nation. It's of top importance.
I mean, you mentioned there's nothing radical about it. I get a sense of déjà vu, thinking back to the New Towns programme in the 1950s, 60s. How is this different?
It's interesting. I mean, the New Towns programme, I guess, had a primary concentration on shifting urban populations out into new settlements. So it was building on the Ebenezer Howard model. And, Ebenezer Howard really doesn't talk about health at all, albeit he's talking about the suburbs salubrious and providing new opportunities for people. But I think what we've lost since the New Towns programme and the Extended Towns programme is that sense of a significant new community. What we've done with these 10 demonstrator sites, we're looking at sites here that will produce 15,000 houses, for example. These are very significant. And we know that we can have a significant impact on the imagining of what communities look like on these sites, relating to the new models of care that we're bringing through in the NHS. So I would say the big difference between this and the new towns is we're still thinking big. We're not thinking as big as the new towns, but we're thinking of it in terms of a completely different burden of disease that the population now suffers from that in the 1960s and 70s.
So we all know the NHS is strapped for cash. We all know that. How effective do you think the NHS? How solid is the success of this, given the NHS resources?
The NHS is strapped for cash to the extent that the population are willing to pay for it, led by politicians. That is the essence of it. I mean, we all want a hugely successful NHS, but we spend at least 1.5 to 2 percentage points of GDP less than France, Germany and the Scandinavian countries. Now, that is at one level an indicator of how efficient the system is because we don't have the overheads of insurance. But at another level, it indicates that we're falling behind, both as a proportion of GDP and as per capita investment in the population. And that, I think, is something that future governments are going to have to pick up. But what we can't continue to do indefinitely is continue to pour money into fixing stuff that's gone wrong and to fixing ill health that was avoidable in the first place.
So I think the short answer is it will save money in the long run if we get this right.
Yes, I mean, if I gave you £1 for every time somebody came to see me as chairman of the NHS with a wheeze that was going to save money in a long time, we'd be right. I mean, everybody says, well, there's a new drug, there's a new imaging device, it's going to save money. Answer is, I've not yet found a technology or a change in the NHS that ever saves money. And the riddle is this, as we prolong people's lives, which is our primary function, and prevent them from the damage of ill health, people will die eventually of something else. And that's not to me about saving money, that's about doing what a health system is designed to do, and to ensure that people live not only long lives, but healthy long lives.
So Malcolm, these principles seem to lend themselves more easily to new settlements, new towns. How do we retrofit this into existing development?
I think there's a lot of learning to do from what we're doing with healthy new settlements. I think, secondly, the way in which we will steadily change the nature of primary care in the health service is going to be important. There are so many awfully deprived areas in England where we've seen cyclical unemployment, we've seen obesity amongst young children, we're seeing the provision of fast food shops near to schools. We're seeing a number of things that are just plain wrong. So some of these principles can be applied directly. We will see, I think, a resurgence of primary care and an improvement of the reach of primary care. And I think also we will see the NHS increasingly as the provider of last resort in these desperate circumstances.
So Malcolm, where does the UK stand compared to the rest of the world? Are we getting it right? Is there anyone out there getting it, doing it better than us?
I think there's terrific experimentation occurring across the world, but no other country has this unique combination of a comprehensive disease planning system and a communitarian system of health provision. And we're missing a huge opportunity unless we continue to bring these two closer together. Health has to have a fundamentally central place in planning.
Thank you. It's a vitally important subject for us all. Extremely interesting. Thank you very much indeed, Sir Malcolm Grant.